And welcome to the Perfect Storm webinar. I am so excited you're here. Most families and parents who find their way to this webinar have a very similar story. Whether you're at the very start and a very beginning of your child's story, or you are the family who has tried everything and nothing has seemed to work, help, or stick. Or maybe you're here trying to seek out some answers because your child has seemingly had one thing after another. If this sounds like you, I first off want to say you're not alone. You're at the right spot. And through this webinar, we're going to talk about what we call the perfect storm. We're going to talk some science, we're going to talk some neurology, we're going to talk chiropractic care, and we're going to end by going through some real perfect storm cases itself. My hope isn't that you leave here with all the answers. That's not my goal and not my expectation. My hope is that you leave here seeing your child through a whole different lens. And maybe more than anything, I hope you leave with some hope. Before we dive any further, I want to introduce myself. I am Dr. Taylor Pearson. I am one of the chiropractors here at the Wellery Chiropractic, and I absolutely adore this slide because I feel like it shows our why so well. At the Wellery, our why is very simple. It's you guys, it's your child, it's your family. We know that so many families who walk through our doors have already been through so much and been through so many other doors, whether it's countless evaluations, specialists, appointments, hours on end of doing research. Maybe you've tried all the different diets, supplements, medications, and all the newest health hacks. You are doing absolutely everything you know how to do and everything you can do because you want to help your child. At the end of the day, it's as simple as that. You guys are looking for answers and hope, and we know that can be exhausting. And at the Wellery, we want this to be a place where parents finally feel heard, where kids feel safe enough to curl up onto our cozy couches and chairs with a baby doll. Maybe you feel like eating some snacks and hanging out in our playroom. And of course, at the end of the day, we hope there's some laughter within our space. We want this to be a place where it feels like home. We always say come early and stay late. We want this to be where a place where you guys can come and finally just take a deep breath of fresh air. We're going to start with an exercise. Your only goal throughout this is to count how many passes the team in white makes.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13.
Anyone get it?
But did you see the moonwalking bear?
Here he comes. Gonna do some great dance moves off the screen here too. So, how many of you completely missed the moonwalking bear that was walking directly through the middle of the screen? I know I did the first time I watched this, and it even took me a minute the second time I did. The point isn't whether you got the answer right, whether you got 13, 20, or 5. And it definitely isn't whether you saw the moonwalking bear or not. The point is that it is incredibly easy to miss something when you aren't looking for it and when you don't know what to look for. And that's exactly what can happen with these perfect storm kiddos, and likely what's been happening with your kids. We get so focused on the individual symptom that is directly right in front of us that whether it's the chronic ear infections, constipation, anxiety, depression, sensory struggles, and sleepless nights, that we often miss the bigger picture itself. And that is what I want to invite you to do. I want to invite you to zoom out and start looking for that moonwalking bear, because when we're able to take that step back and look at the whole story instead of just one symptom, one puzzle piece, we're finally able to see patterns that we likely didn't and couldn't see before. And that is exactly what the perfect storm is all about. So, what is the perfect storm exactly? The perfect storm is an accumulation of stressors that build upon one another. This disrupts or delays normal neurological development. In much simpler terms, it is chemical. physical and emotional stressors that build on top of one another, making it much harder for our nervous system to not only adapt, but respond to the environment the way we were designed to and meant to. The key word here being adapt. One of the primary jobs of our nervous system is to constantly perceive and adapt to everything, not only on the inside of our body, but around us and in our environments. Most of these stressors by themselves are not the problem. The problem is when those stressors begin to accumulate and the timing of them. The more often these stressors are there in our life and the earlier they're there in our life, the more of an impact they have on our nervous system. So think about this like a storm. One raindrop won't cause flooding. One gust of wind will not just knock over a tree. And one cloud in the sky doesn't mean there is going to be a tornado. But when there's enough rain, wind, pressure, and time all coming together, that's when you get the storm. And the nervous system works in a very similar manner and similar way. It's usually not just one thing, it's the accumulation, the sequence, the timing of those stressors. One thing happens, then another, and another. And over time, that buildup can start to show up as symptoms. This is why two children can experience something very similar, yet respond in completely different manners. While every child's story is very unique, we often see very similar sequencing of stressors and sickness over time. And when we get into those perfect storm cases later, that's exactly the case for those two boys. They had very similar stressors and similar timing of those stressors, but the symptoms and the way their storms progressed and showed up looked different. So the sequence of stressors, I mentioned that it can be very different, but the timing is usually early on in life. And this might be whether pregnancy had more physical, emotional stress. Maybe then labor was long, fast, or involved more medical intervention. As that starts to progress and we see some of those early warning signs of the storm in infants, whether this is reflux, colic, maybe it's an infant who can only sleep on top of someone because as soon as they're put down, they cannot console and regulate their own nervous system, whether it's digestive issues, difficulty nursing. As that grows, as that child grows, these symptoms often start to shift and evolve. Now it might look like the toddler or child who is struggling with chronic ear infections. Maybe they are needing ear tubes, whether they have the constant illness and constant sickness coming back and forth, allergies, rashes, big emotions, sensory struggles, impulse control, and maybe they're the child that's falling behind in school. As that child grows up even further, we get the teenager who is exhausted, anxious, depressed, overwhelmed, burnt out, or just feeling like their body cannot keep up with them. This further leads to us as adults who are even further burnt out, stressed, anxious, and so many women today struggling with fertility issues. And that's the bigger point. Kids don't grow out of something, they grow into something else typically. When we're able to take a step back and look at that bigger picture, we often realize that symptoms do not just appear out of nowhere. They change, they evolve, and sometimes they are more connected than what we have ever realized. Another thing, and another phrase you'll hear us say very frequently is common but not normal. Just because something is common does not mean it was and is how the body was designed to function. Today, it is common for us to see and hear babies who struggle with reflux, constipation, colic, sleep challenges. It's common for us to see and hear toddlers with recurrent ear infections. Maybe they're on their second set of tubes. They've had repeated rounds of antibiotics, and now their gut and immune system are really struggling to keep up. They have allergies, rashes. It was common for us to see and hear kids struggling with anxiety, sensory challenges, emotional regulation, focused behavior, and this is happening younger and younger. But common does not mean normal. Often these symptoms are the body's way of telling us something deeper might be going on. Rather than only asking, how do we manage the next symptom or what do we do when the next thing pops up? We want to ask, why is this happening in the first place? This next image I'm going to show is of a C-section, so I wanted to give a little disclaimer and heads up. This really ties everything together that we have talked about so far. Sometimes we have become so familiar with something that we have stopped asking questions. And first off, I want to say this very clearly. Healthy mom and healthy baby is always number one priority. And thank goodness we have these interventions in modern medicine um, that this is a possibility for families to make that healthy transition here. And this isn't about guilt, blame, or birth, or saying that birth should have gone completely differently. But these interventions and stressors have become so common that we almost have stopped appreciating how physically, chemically, and emotionally demanding labor and delivery can be, not only on mom's body and nervous system, but on babies as well. Think about this. For 9 months, that baby lived in a warm, dark, calm, quiet environment. Hopefully calm. I will say maternal and family stress can play a huge role in the storm, as we talked about on a previous slide through there. But think about that environment compared to within moments of being exposed to bright lights, cold air, loud sounds, gravity, touch, movement, and depending on that birth, significant physical stress. And that might be whether it's a really long labor, a really short labor, maybe baby got stuck and cords wrapped around the neck, vacuum assistance, forceps, C-section, delivery, twisting, pulling, or extra physical force around this neck and our cervical region and our brainstem. And that upper neck and brainstem is so important because it is connected to many of our basic functions like breathing, heart rate, digestion, and regulation. And in this picture, we can see exactly that. There's lots of movement. There's hands on us, probably lots of sounds, bright lights, and then let alone we're twisting and torquing and pulling up on this baby's neck with that sensitive tissue being right there, our brainstem. So the big point here is not that birth is bad or birth should be feared or that interventions are bad. It simply means that birth is a huge, significant physical event for mom and baby. And for many of these perfect storm kids, some of these earliest stressors may be present right from the very beginning, whether it was during pregnancy, labor, and birth, or all of the above in a combination. Just because these things are common to happen during this period doesn't mean they are not stressful on that developing nervous system. Remember our moonwalking bear from the beginning? Sometimes we miss things not because they aren't there, but because we haven't been taught to look for them or think about them that way. So, what happens when our nervous system experiences stress like this? We often explain this using this gas versus brake analogy. Think about driving a car. Every car has two pedals. One has a gas and the brake pedal. And our nervous system has two sides to it as well. The first side being our sympathetic. Think about this as your gas pedal. This is our protection side. Fight, flight, freeze. Its job is to protect us and keep us safe. The second side of our nervous system is this parasympathetic side. This is our brake pedal in this analogy. This is where healing happens. This is where rest, digest, grow, develop, and regulation all happens. Both of these systems are incredibly important. You need both a gas and you need a brake pedal, but the goal isn't to be driving around with your foot stuck on the gas all day, and it's definitely not to be driving around slamming on the brakes all day. The goal is to know how and when to use them. So think about this. You're driving down a highway, you're cruising at about 60 miles an hour. If traffic is slowing down, you're able to just gently tap the brake and slow down with traffic. If traffic is speeding up, you're able to gently press on the gas and get moving again and move with traffic. If someone cuts you off, you're able to react. You're able to correct the course and then settle right back into driving in center lane through there. You're constantly making these small adjustments based upon what is happening around you every single day. And that's exactly how a healthy nervous system is designed to work. It should be able to shift between protection and healing with ease. But what we see in so many kids and adults who come into the office is that their nervous system is spending so much time on the gas pedal, their stress response is just stuck on. The nervous system has spent so much time on protection that it is hard for them to shift back into that brake. Over time, their nervous system has adapted to believe that protection is the priority because these physical, chemical stressors have built up early and over time, and often those physical and chemical stressors have started to drive that emotional stress later in life too, and that's where a lot of those like anxiety and depression live. This quote on the right side, you can't be in growth and protection at the same time. This is a quote from Bruce Lipton, and this summarizes the nervous system so beautifully. Our bodies can either prioritize protection or growth. They cannot fully do both at the same time. So if the body cannot be in growth and protection at the same time, the next question we have to start to ask is, where do we start and how do we help this? And this is where the hierarchy of healing becomes really important. Neurological health and healing has a sequence. We don't just develop the way we develop because we develop that way. At the foundation is the autonomic nervous system, your nervous system. This is that gas and brake we have been talking about. And at that foundation level, we are looking at the basics: eat, sleep, and poop. These might seem very simple, but they tell us how much of the nervous system has been functioning. And with so many of our perfect storm cases in kids, this foundation was never really strong from the beginning. Maybe they never slept well. Maybe digestion was always on and off. Maybe they struggled with reflux, constipation, or difficulty nursing. Maybe they had a really hard time calming and regulating their own body. And when that foundation isn't strong, it can start to create that cascade into the levels above it. And now, when we look at the neuromotor system, now movement and coordination have to work much harder. Maybe milestones developed early, delayed, or skipped, or they were not as coordinated as we would like them to be. Then, on top of that, the gut and immune system may start to struggle. We might start to get the coughs and colds and constipation all the time. And then we look at those that very top level, that brain-based symptoms. And these are the things parents are living with every single day with their kiddos. This is where behaviors, sensory struggles, emotional regulation, impulse control, focus, processing, those ADHD type symptoms, anxiety, meltdowns, school struggles. And that is why we say kids do not simply just grow out of something. Sometimes and oftentimes they grow into something else. The symptoms may change over time, but the deeper foundation of the nervous system has been and likely is still struggling. That is why we do not want to only just chase those top level symptoms. They're very important and those symptoms do matter. They're real. And that's usually the reason why families walk through our doors. But we have to ask what is happening at that foundation? Because when that foundation, the nervous system starts to regulate better, everything above has a much better chance to grow, heal, and function the way it was designed to. The goal is not just to have fewer symptoms or asking how do we stop the behavior and manage the next symptom. The goal is to have a stronger foundation and ask what is happening at that foundation. So the reality is we know our kids are struggling, and these statistics are very difficult to ignore. 1 in 4 children are diagnosed with a sensory challenge. 1 in 6 are diagnosed with a chronic illness, and 1 in 3 are diagnosed with an autism spectrum disorder. We have said it a few times tonight, common does not mean normal. If you take anything away from this webinar, let it be that many of these challenges share one thing in common, though, the nervous system. And if the nervous system controls and coordinates every function of the body, it makes sense that we should evaluate it. Not guess, not assume, but actually assess how it is functioning. Before we can help a child move from protection into growth, we first have to identify where that stuck stress might be showing up within their nervous system. And this is why the nervous system matters so much. This chart shows us that the nerves coming from the spine itself are not just about neck and back pain. They're communication pathways between the brain and the body. Every nerve helps communicate and coordinate specific functions of organs, glands, tissues, muscles, and systems throughout our entire body. And when there is significant stuck stress in those areas, communication becomes less clear. And when communication becomes less clear, function is affected. And this is one of the main ways symptoms begin to show up in these different areas. For perfect storm kids, we pay very close attention to this upper neck region, this upper cervical spine, that C1, C2, C3. This is because that area sits right below our brainstem, so where many of our autonomic nervous system functions, our basic functions, are coordinated and regulated. And this becomes where the vagus nerve itself becomes a really big part of the conversation. The vagus nerve is the primary communication highway between the brain and the body. It plays major roles in digestion, immune function, heart rate, breathing, emotional regulation, and helping the body shift to that parasympathetic side of the nervous system. So when we talk about kids being stuck on the gas or having a really hard time accessing the brake, this area and the vagus nerve becomes very important. When we talk with perfect storm families, we never want to rely on just the story alone, and we never want to rely on what we're going to talk about next, these neurological scans alone. We want both of those. The story tells us what your child has been through, and those scans we're going to talk about helps us see how the nervous system is currently functioning. And one of the biggest things we want to see, and things we do see with the scan, is that it helps us understand what the body is telling the brain. because the brain is constantly listening to the body. And if the body is sending clear, organized, balanced information, the brain usually responds and regulates much more clear. But if the body, and oftentimes what we see is sending loud, disorganized, mixed signals, and there's lack of communication, the brain has to work much harder to understand what is really going on and how to even respond. And this is what you guys see. This is that other side of that. You guys are seeing the outputs of a dysregulated nervous system. You guys are seeing the behavior, the emotional outbursts, the focus struggles. You're hearing from your kids' teachers that they are falling behind. You're dealing with the impulse control. You struggle to go out in public just because you just don't know what's going to happen. And the body just, you just notice that it's not regulating the way it's meant to. So these scans really help us connect that dots and those different pieces. They help us better understand where that stress might be showing up, how the brain and body are communicating, and how much adaptability the nervous system has overall. So instead of guessing, we have more information. Uh, we can say this is where the nervous system needs more support, and then create that very specific plan around your child's story and those specific scan findings. This first scan we're going to talk about is called a rolling thermal. This is completely safe to do on babies. We do it in every patient that comes in. One of the main jobs that we've talked about with our nervous system is to constantly perceive what is happening in and around us and then make changes and adapt. The scan looks at specifically temperature differences from side to side, so left to right. And ideally, we want to see left and right sides be within similar range of each other, saying our nervous system is doing a good job at adapting and keeping up with our environment. When we do see more of a significant temperature difference from side to side, which is that red you're seeing here, it tells us the nervous system is not adapting the way it's meant to. And in simple terms, the scan shows us where to check. It gives us clues to where the stress might be stuck and has set up shop in the nervous system and where we need to pay close attention to. And this really shows us where these very specific nervous system based adjustments of where we're going to go first. This pattern typically we see on this one very specifically is the upper neck. So I talked about that with the perfect storm kids, is that that's often what we see, and that's our first spot we're going to go to typically. This next one is our surface EMG scan. This scan helps us understand what the body is telling the brain. On the scan, we want to see the results appear within this gray pear shape through here. This specific case and kid here is these black squiggly lines. The three main points and scores we look at on this scan is energy index, pattern, and symmetry. Think about energy index like the noise level or the volume level. Is the body communicating with the brain at an appropriate level, or is the body yelling at the brain all day long and the brain is trying to make sense of it? Think about this. It's like 20 teenagers. You're in a tiny room and they're all trying to tell you the same thing all at once. The brain has no idea what it's supposed to do with all of that information. Then we look at pattern and symmetry together. These scores tell us how organized and balanced that communication is. Is the information going to the brain smooth, clear, and easy to understand and process, or is it chaotic, disorganized, and uneven like it is in this case? So big picture, this scan helps us understand what kind of message the body is telling the brain. And when that brain in these cases is telling the body's telling the brain in these cases loud, disorganized, chaotic information all day long, that output then starts to look loud, disorganized, and chaos as well. And this is where you guys, as parents, you see the focus struggles, emotional regulation. Maybe it's just the kid that cannot sit still, impulse control. So when we look at the scan, we're not just looking at the numbers here. We're asking, what is the child's body telling their brain, and how does that connect with what you guys are telling us and what you guys are seeing day to day? This next one and our final scan we're going to go through is HRV, or heart rate variability. This scan gives us a higher level look at the overall health, adaptability, and reserves of the nervous system. In simple terms, we're asking, does this nervous system specifically have enough capacity to handle everyday stress and still recover? And what has the nervous system been doing for most of their life? The goal is to be within the green box and nice and midline, meaning the nervous system can access both that gas, that sympathetic side, and our brake, our parasympathetic side. Oftentimes, these kids and adults who are coming in, we are worn out and wound up. We're foot stuck on gas, but we're just depleted. We're running on E. And once we have been there for that gas for a period of time, the system starts to wear out. Now we aren't necessarily wound up, but this looks more exhausted, fatigued, depleted, and that's where we shift over into this brake pedal most of the time. And this scan does change depending on what life has looked like and what is currently going on in our life as well. And often what we can see is if we've had a weekend out of routine, maybe a weekend up at the cabin, a weekend with grandpa and grandma where more sugar is going through our system. We've had less sleep, more stimulation, more screens, more stress, antibiotics, sickness, or just more of a load on our nervous system. This is why the scan is so helpful. It gives us that higher level view of how much reserves the nervous system has, how well it can shift, recover, and adapt to those different stressors that we see from day to day. We're going to get into some perfect storm cases here. I am really excited, and we're going to be starting off with Bennett. Bennett came to us when he was 9 years old. He had been diagnosed with ADHD within first grade, and his family had tried various ADHD medications and different combinations to really help. They really didn't see that much of a difference, and mom and dad really wanted him off of these medications. So eventually, they decided to stop the medications. At that time, Bennett actually started to develop motor tics within his neck, and those tics had become so intense that he was getting headaches, upper back pain, and neck pain from them. His parents also started to notice around that time with the tics developing that his confidence not only in sports, but in school really started to dip, and his focus was being really affected. They followed up with their primary and they were told to schedule with a neurologist and schedule an MRI. That didn't sit well with his parents, and they came and found us. When his parents came to us, we started doing what we were talking about all night. We didn't just look at the ADHD, we didn't just look at the motor tics. We started to dig deeper into his story to really figure out where the storm began and how long this has been within his nervous system. And in doing so, that's when we learned that during mom's pregnancy, she had very large fibroids that were told and thought to contribute to preterm labor. She was then hospitalized for 2 days and given medications to stop the labor. That medication, and not long after, eventually caused a urinary tract infection, which further caused issues and stress during her pregnancy. Bennett was born at 39 weeks, but there was a lot of physical stress around his birth. He ended up getting stuck. Mom had to have an episiotomy. He had to be vacuum assisted out, and his cord was wrapped around his neck. So, from the very beginning, Bennett's nervous system had experienced a lot of physical stress. There was this physical stress and likely this twisting, torquing through the neck as we're being vacuum assisted out, we're being pulled, the cord wrapped around the neck, that twisting, torquing we talked about earlier. As we dived further into his story, his mom also shared that he hit his milestones very early, and that is typically assigned to Dr. Chan and I that tension has been there since birth, likely. And often when we hear the that milestones were hit early, and these are typically the kids that show up to us that like they're holding their head up at just days old, they're rolling, or they're moving really quickly through milestones, and sometimes those milestones are not happening in the ideal order or with the best coordination that is ideal range for us and the nervous system. He also had constipation on and off throughout his life. And throughout childhood, he had been on multiple rounds of antibiotics for various reasons. He also had been more recently struggling with hyperhidrosis, which is excessive sweating and difficulty regulating temperature of his body, which we talked about. This is a function of the nervous system, and specifically what that thermal scan is measuring. So we were really curious to see that scan, and that's the scan we're going to dive deeper into for Bennett here. So when we look at Bennett's scans here, we're looking specifically at his thermal scan. Again, it's showing us very specific areas of stuck stress. We initially scanned him over here in January, and right away, Dr. Chen and I saw C2 significant stress through there. And this made so much sense with his story. C2 is such an important area where we're talking about that coordination of motor function, temperature regulation, emotional regulation, focus, our brain-gut connection. So instead of guessing, we were able to see that this is likely the area where Bennett's nervous system had been holding on to stress for so long. And this gave us really encouraging information because it gave us a clear place to start. We got Bennett started on a care plan, and after 12 adjustments, we rescanned him, and that's a scan right here in the middle in February. Right away, we can see that that significant stuck stress had started to clear out from his nervous system, and it went from significant to mild, and that C2 had completely cleared out, but still really working through his upper neck, C1, and mid back areas. But we were seeing this change, and thinking about his story, it had stress and that perfect storm set up shop all the way back in pregnancy, had been there for a period of time. His nervous system had adapted and learned to function this way. So it took time, frequency, and repetition to help his brain and body to communicate in a whole new and different way. This last scan over here in April, so about 4 months into his care plan and adjustments, we saw a clear scan. His nervous system was no longer showing that same level of stress. And when his nervous system was able to finally let go of that stress throughout his care, his nervous system had a much better chance to communicate and engage in the way it was designed to. And not only did his scan show awesome improvement, but what Bennett knows day to day and what his parents know today was huge. So not only did Bennett's tics get better, but they noticed improvements in all different areas of his life that weren't even top of the mind for his parents when they very first came in. His sleep was better, his digestion was better, his energy was better, his focus improved. He was having less homework at school and able to come home and do these outside activities he loved and hasn't been able to do for a period of time. His immune system was better. He wasn't getting all these different coughs and colds his younger brother was, or if he did, he was recovering and bouncing back so much quicker. His mood was improved, and honestly, one of the biggest things his parents noticed and we noticed ourselves was that his confidence had skyrocketed. It's still one of my favorite stories in clinic, and one of my favorite transformations that we have seen. He's such a fun, funny kid now, and seeing him come from this shell, lacking confidence, into being more of this super confident, funny kid that he is today, it was really transformational to see that. And if you relate to that story, we hear ya, we see ya. This next case we're going to go through is Tyler's case. So Tyler and Bennett are a really good example of how the stress can set up shop at very similar timings, and the types of stress is very similar, but the output that parents were seeing were very different of each other. So Tyler and his family came to us when he was 11 years old. And honestly, we were their last resort. They had tried all the things, all the different professions, all the different supplements, all the different diets, and his parents had lost hope that they would ever see their son be their son again. Mom had Tyler very close to his older sibling. I think she got pregnant when his older brother was about 10 months old or so. So she was stressed throughout pregnancy, trying to keep up with an infant and almost 1 year old. And then this led to a more stressful postpartum period as well with two young kids. As she explained her birth story to us, she told us she barely made it to the hospital. And she explained it that they basically had to catch him as she was climbing onto the bed at the hospital. So he came very quick into this world. It was not this nice, smooth transition of, okay, nice deep breath into the lungs. It was, we're here. So right away into that gas pedal, that fight versus flight, likely for his nervous system. Tyler also had multiple rounds of antibiotics for strep and various skin infections. Tyler, very similar to Bennett, was diagnosed with ADHD and struggled with some emotional regulation. For Tyler, this looked more of these aggressive outbursts and then really wouldn't remember them following it. More recently, he would get very fatigued after activities and had severe leg pain. He wasn't able to participate in these outside activities, sports, and in gym class because of the pain and fatigue he was experiencing. And one of this family's biggest goals coming into care was that they had this planned family vacation and trip. And it was a very physically demanding one with skiing, hiking, and all the things. And they were really, really unsure if they could even do this trip due to Tyler's health. Huge spoiler here. Not only did they get to go on their trip, but Tyler absolutely thrived. He did skiing, he did all the hiking, and we got to see all the photos from it. And it was so fun watching them come back. And I very specifically remember mom coming and talking to Dr. Chad, and she told us she was like, I have my son back. Like I'm seeing Tyler for Tyler again. And Dr. Chad and I still talk about that all the time here. We're gonna dive into Tyler's scans here. So we're looking at his surface EMG, and I'll be honest, visually looking at this scan specifically does not look as drastic or as clear of improvement and change as it did with Bennett's thermal scans. But what I love about these scans and the training Dr. Chan and I very intentionally do to be able to interpret and read them is that often the biggest changes are in the very fine, minute details, not in the big overall picture. So for Tyler, the biggest concern was not necessarily that index that we were talking about, that noise level. It was talking, his body was talking to his brain at a nice, smooth, pretty even level. But the bigger thing we noticed was his pattern and symmetry. When we're looking at what his body was telling his brain, again, his storm had been for 11 years, and this was really affecting brain body in communication at its deepest level. His pattern and symmetry scores showed us that the information going from the brain was disorganized and uneven. We can see that at the 20 and 50. And his brain was getting mixed signals. And if we go back to the idea that the brain is only as good as what the body is trying to tell it, this helps us understand why Tyler's output looks so chaotic too. His body was sending disorganized, mixed information up to the brain, and for Tyler, this showed up as immune system flares, chronic fatigue, difficulty regulating his emotions, and severe leg pains after activities. As we continued through his care, those numbers continued to improve. We saw more organization, we saw more symmetry progress through February and June, and his nervous system, as it was sending more organized and less chaotic information to the brain, the output became less chaotic and more organized as well. For Tyler, this was fewer immune reactions, fewer rashes. He had his best allergy season yet, and he was able to participate in gym class and additional activities outside without getting super fatigued or having severe pains. His mood was so much lighter, and it wasn't even a conversation between his parents and him anymore, and between us. And most importantly, after they felt like they had tried all the things, they finally felt like they got to see their son at the deepest level again. I love talking about these two cases because they're really good examples of how the storm can brew very similarly, but present very differently. The stressors may be similar, the timing may be similar, but where the nervous system shows that stress and how that child's symptoms show up can look completely different. For Bennett, we saw more of that stock stress showing up in his upper neck of his spine on his thermal scan. For Tyler, we saw that disorganized brain body communication showing up on his surface EMG, different scans, different patterns, different symptoms, but the same bigger picture. Their nervous system had been carrying stress for an extended period of time. This is why the story matters, and this is why the scans matter. The story helps parents connect the dots and us connect the dots, and hopefully make you guys go, oh my gosh, this makes so much sense. And the scans help us see what the nervous system has been trying to tell us underneath the surface for likely years now. And we want to understand both. As we wrap up, I want to leave you with a few action steps here. First of all, keep seeking hope, answers, and help. If your gut has been telling you that something deeper is going on with your child, keep listening to that. You're not crazy, you're not alone, and you do not have to keep guessing. And I want to slow down here for a second because I want to bring this back to Tyler and Bennett's stories. Their stories did not start with us having all the answers. Their stories started with their parents reaching out. It started with a conversation. It started with the scans. And from there, we were able to say, okay, here's some areas where their nervous system is really holding on to stress and struggling to keep up. And here's some good places where the brain body communication and the nervous system needs that support. And here's how we can start helping. Then we created a plan. We talked through expectations. We talked through time, frequency, and repetition because when a child's nervous system has been adapting a certain way for years, it takes time to help it learn a different way. And then over time, we got to watch their stories change. For Bennett, less stock stress, fewer tics, better sleep. For Tyler, that was more organized brain body communication, fewer immune reactions, less fatigue, and his parents finally getting to see their son be their son again. And we know there are more kids out there who are struggling. And many of you guys watching this, your kids are going through stuff too. We know there are more families who are tired, overwhelmed, and wondering if there's something deeper going on. And we would love to start that conversation with you as well. The next step is to schedule nervous system scans for your child or even yourself so we can start connecting your story, connecting the dots with what the nervous system is showing us and trying to tell us. If any of this has resonated with you, we would love to connect with you, hear your child's story, your story. If you reach out and mention this webinar, we have a $100 new patient special. This includes the initial conversation with Dr. Chad and I, where we talk more about your story, answer any questions you have, talk more about what adjustments look like, what scans can show, and how we might be able to help your child. We will also create a personalized care plan for you and your child, and this includes that first adjustment. I want to thank you all so much for taking the time to listen and to learn. I hope this gave you some clarity, direction, and hopefully some hope. Dr. Chen and I are always here as a resource for you, and the Wellery is always here as a resource, and our door is always open. Thank you.